I'm in the library this morning in Dr. Miriam Smith, and today I'll talk about nurse as a communicator. Nurses have to be creative as they deal with patients. There's no one patient. There are no patient, two patients alike. So the individualized care has to be done in such a way for each patient that the patient will have a sense of worth, have a sense of belonging, and one who confides in the nurse. And that usually happens during routine care, during a bed bath, during giving medication, or just general talking to the patient, finding out how the patient is feeling. So communication is critical. This skill has to be developed because not everybody, not every nurse, not every young nurse knows how. Sometimes we have to do extra communication courses in communication because there's so many different types. Communication to everyone is exchange of words, exchange of experience, whether it's verbal or non-verbal. And so it's so important as we give our individualized care to our patients to be aware of that. Patients also communicate back with us, as with the nurses, as they share their stories, as they share their symptoms, as they share their experiences, whether they're sad or whether they're happy or whether they're not sure of what's happening. And the nurse is the one who most times receive that type of information because the nurses are the one who stay longest with the patients. Therapists might come in, do a certain procedure and they've left. The doctor might come to a round, say a few words or so, a little routine, and they're left. But the nurse is the one who's constantly there, hearing, weighing, talking, doing procedures, vital signs, hanging IVs, making the bed, sharing the medication. It's just so much that the nurse does for the patient. And so communication is critical. Effective communication. You must remember, nurses must remember, you got to be clear, you got to be timely, you got to be relevant. These are some of the elements that are needed in communication to be effective. And you have to bear in mind also that non-verbally is just as important, and sometimes even more important than verbal, because one might be saying, I care, but yet you haven't seen the action going behind that to show that you really care for the patient, or you're really doing this for the patient, or you're giving a listening ear. The patients, you're talking to the patient. In this culture, we support eyeballing, we support looking into the eye. That shows respect in our culture. In other cultures might be different, might be disrespect, but this culture that we serve. So it's also important to understand the culture of the patients we're caring for. Communication is critical, non-verbal as well as. If I come to the door and I'm hasting, I'm rushing, I'm just peeping or something like that, as opposed to I come in, I say my name, I say what I'm about to do for you today, how are you doing, build that patient-nurse relationship. In communication, this is critical, and this will help in the care, the satisfaction of the patient ultimately. If we care with love and compassion and empathize, these are some of the attributes that will enhance the patient satisfaction. So my new nurse today, and the older nurses too, just remember, give a listening ear to the patient and say what you mean. Because if you say you care and you don't show it, that is conflicting. So let's endeavor to do the best for our patients. And at the end of it all, the patient will be satisfied, the nurse will be satisfied, the institution will maintain a certain high standard, whereby patient will come to that institution expecting to receive high quality care. Thank you. You can connect with me on on YouTube at Miriam Amanda Smith, Instagram, Podcast Mir, TikTok, Facebook, of course at Apple. Have a great day.